Hey guys, Dr Davin Lim, board certified laser dermatologist. Before we go on to the video in regards to how to treat hormonal acne, I'll give you a sneak peek on what a dermatology office looks like. So before most of us recommend products or endorse products or recommend anything or prescribe anything to patients, generally speaking, most dermatologists would have trialed it on themselves first. So we get given things like these little trial kits. This one's from La Roche-Posay, so we know what the product feels like on our skin, and that's mainly a subjective viewpoint rather than an objective viewpoint. So we've got everything from Toleraine all the way to discovery kits from Avene, the whole lot. And generally speaking, we can't use the entire lot because we just get given too many stuff. So that's the perks of being a dermatologist. So let's get into this video. The last video I did a few weeks ago was how to treat acne before seeing a dermatologist. Today's video is more specific, and that's how to treat hormonal acne. Now, just to clarify things, hormonal acne, generally speaking, occurs in females. Do males get it? Yes, we can, but generally speaking, it's due to, and this is the truth, anabolic steroid use. That's how males get hormonal acne. How does hormonal acne differ from normal acne? Well, normal acne, you'll see, actually affects the T-zone area, right? So that's what we call the forehead area, the nose, and it usually has blackheads, pustules, and zits. Yeah, so that's normal acne. Whilst hormonal acne is totally different. It usually affects the jawline area and the cheeks, and it occurs usually, as the name suggests, adult female jawline hormonal acne, usually in adults over the age of 25. So statistically, 25%, so that's 1/4 of females over the age of 25 will suffer from adult jawline hormonal acne, right? So it's very, very common, and research has shown that the incidence is actually increasing. So just to debunk a few myths, some people say, hey, is it the hormones we're feeding the chickens or the beef? It's a testosterone in that. No, it's not. It's partially due to food, but it's more complex than that because hormonal acne is due to many factors, including genetics, so you can't help that. It's also due to stress. It's also due to foods, and it's also due to environmental factors, including what we put on our face, the makeup you use, the cleansers you use, the moisturizers, your actives, and the whole lot. And then there's the hormonal influx, which I'll go through later on. So why does it occur? Basically, it occurs due to all those factors, but it occurs at a certain time of your life. And it's usually, like I said, over the age of 25. And they form these deep, painful, periodic, in other words, there's a cycle to it. It may occur, within a week of your period cycle, and it's usually around the jawline area. And you'll see that most patients actually try to squeeze it, but you can't squeeze it because they're blind-headed pimples, which means it's called acne excoriae, which means you're actually digging into it, which may cause scarring. So one of the biggest causes of scarring I see is due to hormonal acne. Now, why do you get hormonal acne? Well, like I said, it's partly due to everything else. You can't pinpoint it on one factor. So it's generally due to a fluctuation in the hormone cycle. So as we grow older, as females grow older, and even males, there's a different flux in regards to testosterone and estrogen. So we start off here with testosterone and estrogen, and testosterone, I mean by androgen. So that includes something like free testosterone, 17-hydroxyprogesterone, dihydroepiandrosterone estate, and many others. Okay, so these basically bind to receptors on your oil gland, activate the oil gland, and cause acne. So the other upside is that you've got estrogens. So as females grow older, the flux basically changes. Your testosterone levels or androgen level, free androgen levels remain, but your estrogen levels may drop. So that's why you can have acne even at the age of 30 or 40 if you're female, because your estrogen levels drop and your free testosterone and androgens remain the same. Okay? The other side of things is that there are many other causes of hormonal acne that go well beyond the context of this lecture. Things like prolactin levels, like I said, 17-hydroxyprogesterone, congenital adrenal hyperplasia, free testosterone from ovarian causes, and many other causes. Like I said, it goes far beyond this. So a good dermatologist would, generally speaking, would check your hormone levels to exclude all the other causes and go, hey, you've got hormonal acne. So the big question, I guess, is how to treat it, how to actually treat hormonal acne. Well, it's difficult because at the end of the day, we're treating the hormonal changes. Now, we always start with the basics, and the basics of this, you start off with non-comedogenic products. So most importantly is your makeup. So make sure your makeup is something like a mineral makeup and not a liquid foundation, because they can clog up pores. And make sure you let your skin breathe for at least 2 days per week. Okay, so that's very important, your makeup. Everything else, like your sunscreen counts and even your actives. See, what we're looking for is something called a non-comedogenic. So something like The Ordinary, for example, I find an excellent, I mean, if I'm going to do a review on this, which I will shortly, this is look, seriously, bang for bucks. You can't beat this. But in this situation, it hasn't got non-comedogenic. In other words, this can form acne. So the flip side is this. It doesn't mean that if you use this, even though it says it has not got non-comedogenic, that you will get acne. So trial it out. If you do get acne, stop it. But as a rule, look for the words non-comedogenic, in other words, not acne forming. But the flip side is that it's not always the case, because some non-comedogenic products can actually cause acne and some comedogenic products do not cause acne. So always have that balanced viewpoint, because skin is as individual as you are and not just on the packaging. That's the biggest hint I can give you guys. So you start off with that. If that doesn't work, certainly you can go for your retinoids, your vitamin A. You can get retinol over the counter, or you can get this, which are basically prescription retinoids. Yes, I know adapalene, which is different, you can buy over the counter in the US, but in Australia you do need a script. So this can help as well. A short course of antibiotics such as doxycycline can help, not because we're fighting the pustules or P. acnes, is that because doxycycline is an anti-inflammatory. And that short course of doxycycline, so time out for maybe 4 weeks, can actually reduce your inflammation and just break that cycle. So antibiotics can certainly help. Do we like prescribing antibiotics? The answer is no, but can it help some patients? The answer is yes, and it's probably the least invasive of all oral medication that we can treat acne with. Going up from there, it's still the basics. It's all the AHAs, the alpha hydroxy acids. Light can help, as in phototherapy, using blue light and red light, because they're anti-inflammatory as well. And certainly things like chemical peels. And the chemical peels which we like are basically the alpha hydroxy acids, or even better still, the beta hydroxy acids, because the BHA peels are anti-inflammatory and they can actually help exfoliate any comedones. But remember, most of the time you're dealing with deep-seated lesions. So that's why don't be distraught if peels and topicals, even you're using vitamin B's and taking supplements such as zinc and all that doesn't help, because we're dealing with deep-seated hormonal acne, which comes from the inside. What else can you do before seeing a dermatologist? And the answer is diet. So as you know, hormonal acne can flare up with diet, and we know why. It's not due to the chicken or due to the beef that we eat or the hormones that are fed to them. It's due to the fact that refined foods, such as ones with high in sugar, can actually work through what's known as the IGF, so insulin-like growth factor pathway. And we know very well now that foods can actually flare up acne. So for example, foods high in sugar and also dairy products. So if you're a fan of dairy products, well, you might want to actually go for soy. Yes, it doesn't taste as good, but it could save you from actually going on medication for acne. So here's the crunch line, guys. For hormonal acne, in most situations, in 80% of situations, you probably do need to see a dermatologist because we are treating you internally. So you try everything else first. Like I said, I'm not for medication. In fact, I'm anti-medication. That's why I don't prescribe my laser and I do procedures. So I'm anti-medication, but acknowledging that there's some dermatologists out there who will treat you for hormonal acne, and as a result, they will treat your hormones to give you that balance. So things like the pill, whether it be Diane, because it contains something called cypertone acetate, or Yaz or Yasmin, because it contains an anti-androgen called Spironolactone. So what these anti-hormones do is they stop your free hormones, in other words, your androgens. Remember, your androgens are the ones which cause acne, from binding to the oil gland, which then gives an increase in oil production, sebum, clogs your pores, and gives you acne. So one method is to use anti-hormones. Second method is to actually use an old-fashioned treatment, but it actually works really well, called Spironolactone. And most dermatologists, certainly when I used to do general dermatology 10 years ago, that was my favorite treatment for hormonal acne, because in my opinion it's far safer than Accutane. So last of all, for treating hormonal acne is this, which is basically Accutane, the devil's advocate. In other words, it's a double-edged sword. No one likes prescribing this. No one, I think no normal dermatologist likes endorsing it. But do we use it? Yes, we do, for cases which are either scarring. So when you get this picking acne, when it comes to hormonal acne where it scars, certainly most good dermatologists will actually move you up the scale very quickly to actually stop you picking, stop the outbreak, stop the scarring, and get you on track. So unlike treating teenage acne or normal T-zone acne, where you require, realistically between 20 to 40 to 50 milligrams per day, treating hormonal acne with Accutane is super easy. Most patients respond to 2 to 3 tablets per week, and that way you don't have a lot of the bad side effects such as sun sensitivity, dry lips, muscle aches, pains, irregular period cycles, etc, etc, etc. So it's a totally different process, so don't be afraid if your dermatologist decides to actually prescribe you this, because nothing else works. Guys, I hope that you found that useful. I'm telling you the absolute truth. I've got nothing more to give in regards to hormonal acne, okay? A good dermatologist would review you, if need, investigate you and give you treatment options. But like I said, before you see a dermatologist, try all those other things first, because believe it or not, we do not like to prescribe medication if we don't need to. Guys, thanks very much for watching this short segment, 10-minute segment on hormonal acne, and I hope that clarifies and debunks a lot of myths out there. So 80% of the time, yes, we do need to actually use medication, but in 20% of the time, it can be cleared up using all the methods I described. Guys, if you like this, please share, subscribe, and I'll see you the same time, same place next week. And by all means, this is an interactive channel, so please leave your comments below. Happy to respond to them. And I'll talk more about acne scarring and how to revise acne scars in the next few weeks. Catch you then. Bye.